So, hello to all the viewers. With me, I have got Dr. Athira Prasad, All India rank 114 in NEET PG 2025. Hearty congratulations and extremely proud of you, Dr. Athira.
Thank you, sir.
Athira, so the results have just been announced, and how is that feeling? Are you completely happy?
Yes, sir, I'm very happy. I can't express it actually. I am extremely happy that, I was.
Yeah. So after a lot of uncertainties regarding the NEET PG exam dates, I'm sure, mentally also it would have been tough going through this phase, but finally you have managed this amazing rank of 114. So hearty congratulations.
Thank you, sir, once again.
Yeah. And Athira, I think the viewers will like to know more about your journey because I'm sure a lot of your advices will help the future aspirants as well, because you have got such a rank in such a competitive exam. So let us talk more about your journey. First of all, tell us that you did your MBBS from which college?
I did my MBBS from Calicut Medical College. I am from 2018 batch.
18 batch. So Athira, since when did you start using the DocTutorials app?
I started using right from my final year. Actually, we got some free videos. Actually, I started using from then. I saw some medicine lectures and I felt it is very comfortable to use.
Okay.
Yeah.
And then you started using the, DocTutorials app, right?
Yeah. Yes.
And then after your final year journey, then when it came to the entrance preparation, why did you choose DocTutorials for your PG entrance preparation?
Sir, I chose DocTutorials because I felt the faculties are extremely good. Actually, all subjects are very good in DocTutorials. Actually, it's very clear. They're just very conceptual. Actually, we can understand each and every subjects very well. Actually, I am a person who want to know everything very detailed. Then only I can study better. So I felt that this platform is well for my method of learning also.
Right. So you felt that the platform, was quite understandable too for, entrance preparation.
Sir, I felt the platform is self-sufficient in all the aspects. Even the question banks are extremely good. It is like the real exam itself. So we never feel that this is the grand tests are almost similar to real exam. There are easy questions, difficult questions. So we feel that the same exam we are writing in NEET PG also.
Right. So for your PG entrance journey, was DocTutorials the main source of preparation?
Yes, sir, of course.
Yeah. And so coming to individual lectures in the DocTutorials app, first coming to the medicine lectures, we all know that medicine is very vast. So obviously it carries good weightage for the exam as well. So how did you find the medicine lectures in the DocTutorials app?
So medicine lectures in DocTutorials are very, very conceptual actually. We feel that medicine is a doable subject once we go through the app actually. And there's a lot of confusion regarding medicine in different platforms, but only in this platform we can get a clear-cut idea how to learn, how to prepare ourselves for the exam. That's a very unique feature of DocTutorials.
Yeah. And approximately what percentage of the main videos have you watched, the medicine videos?
I have watched approximately above 95% of medicine.
I asked this specifically because, because medicine is vast. So a topper like you, the students who are preparing right now, they would want to know like whether medicine should be watched in depth or is doing patho, pharma, micro, will it substitute learning medicine? But as you rightly said,
no, sir.
You have gone through the medicine content as such, right?
No, sir. Even if we learn medicine, we can learn other subjects as well. Patho, micro, everything. Actually, we should have a strong background in medicine. I personally feel like that. And DocTutorials is very helpful in achieving that actually. Yeah.
Right. And also, did you go through the revision videos as well? For example, in medicine, we have done the quick revision video. So for example, if you take a system like rheumatology, You might have watched the main videos, but there is a very concise version, that is the QRP section, where I have taken each topic and I have concised into very small lectures. So did you find that
Yes.
also beneficial?
Yeah, sir. That actually that videos are very beneficial because actually from that rheumatology we had exact words in NEET PG. So many questions were from exact words were there from the revision videos. Actually, that revision videos are very helpful, especially for people who are preparing for a short period of time, say like 6 months. They can actually watch that videos and go. That is extremely helpful.
Right. So I think this is for the viewers as well. In fact, all 19 subject QRP videos of DocTutorials, I feel they are very high yielding, especially for candidates, having time limitation. The new version, version 5.0 QRP videos are very, very useful. And I strongly urge all the future aspirants also to go through the QRP videos as well. Now, Athira, coming to other subjects, let us take a subject like PSM. Again, we know that PSM is a subject that has this much of weightage for NEET PG INI-CET.
Yes,
So tell us what were the PSM lectures in the DocTutorials app, and how did it help to simplify the subject?
so PSM lectures and doctorals are actually it is very nice, very excellent actually. Rajasi ma'am has done her all efforts in making that videos so watchable. Actually, she is very excited to teach, I feel. And she clears all her doubts in her app, in her WhatsApp group as well. And she's always very active in that group. And she's an extremely great faculty, I feel. She even in 12 o'clock, 1 o'clock, she used to answer our doubts. And that is actually extremely helpful. I'm very thankful to her.
And also
And
areas that are likely to
and
cause
almost
confusion to the students, like biostatistics. So watching madam's lectures, did it actually help to give you a clear
yes.
understanding of the topic?
Yes, sir. She explains everything to the core. She's extremely great faculty, I feel. She's wonderful. Actually, PSM carries a huge weightage in NEET PG as well. So watching PSM from DocTutorials app is extremely helpful to get a good rank. That is, of course, true.
Right. And again, we cannot neglect the importance of smaller subjects as well, like
Yeah.
ENT. ENT lectures in DocTutorials, I think Dhawan sir has done a wonderful job in the new version V 5.0. Sir has included many operative videos as well. So how did you find the ENT lectures in the DocTutorials app?
Yeah. Actually making the subject very interesting. He's showing lots of videos, and he's actually I feel he's extremely great faculty in ENT, especially QRP videos are extremely good. He explains everything in the QRP itself. Actually, it is about a 12-hour video. Actually, the entire ENT is covered in QRP. It is excellent, and I can't say anything about it. It's actually very good for everyone. Very good.
Yeah. I think it's a very important point that you have pointed out. Sir has put a lot of effort for the
Yeah.
QRP new version as well, and even
Yeah.
told me as well. If you watch that itself, almost 90% of questions that come in ENT will be covered even
Yes.
in that revision video
Yes,
alone.
sir.
So I think that definitely is high yielding.
Yes, sir.
Now
And
coming
one
to
more I want to
yeah, yeah, please,
Sir,
please.
only DocTutorials provides free videos and free questions for students. All type of INI-CET rank decider series, T20, 2020 series. Only I think this app provides the free questions to students without even subscription. That's actually extremely useful thing, I see.
Did you watch all these the 2020 RDX series, those mini exams? Because
Yes,
it is
sir.
always exciting, right, to write these small exams
Yeah.
followed by a GT. So what is your
Yes,
opinion
sir.
about the RDX series for the INI-CET exam and the 2020 series for the NEET PG?
Sir, that helps a lot actually. We can get almost 20 questions of 20 questions of each subject with 1 hour actually. There's a 1 hour short discussion also. So we can revise that subject with 1 hour. I think that's a very helpful thing, I feel. And we can get a confidence on that subject also.
Right. And then coming to say a subject like pediatrics, again, Sandeep Sharma sir is well known for making the lectures very concise and crisp. At the same time, discussing the updated protocols as well.
Yeah.
So I know that you have got a wonderful rank for INI-CET as well, rank 62.
Yeah.
So how did the pediatric lectures help you?
Pediatrics lectures are very good in that. Actually, we have to learn pediatrics from Sandeep Sharma sir only. I personally feel like that. Pediatrics should be learned from him itself. He teaches everything. Actually, we can answer some pathology questions and even biochemistry questions from pediatrics. I feel, especially the glycogen storage disorders and all. He explains very well.
Right.
Actually.
Right. And then, coming to other subjects like pathology, because pathology is again a rank deciding subject for INI-CET as well as for NEET PG. And your comment on the pathology lectures?
Actually, almost 100% questions were from DocTutorials App itself for NEET PG as well as INI-CET. Actually, this is true only. Almost we can get 100% questions from Vandana ma'am's class. And she explains everything very nicely and very conceptually, actually. She's extremely good faculty in pathology.
Right. And coming to, again, shorter subjects like dermatology, when Pallavi ma'am teaches, she includes a lot of images as well, in her lectures. Even though you consider dermatology to be a short subject, it is definitely having a high yield as well. So how were the dermatology lectures in DocTutorials?
Actually, dermatology is integrated with many subjects. Actually, we have to learn dermatology very well, and Pallavi ma'am teaches it very nicely. She even integrates microbiology, medicine, everything with it. And it's extremely helpful, especially her revision videos are very good in dermatology.
Right. And it is nice to know that a topper like you have made use of the revision videos as well. This is an important point that all the aspirants should take, because sometimes what happens is, sometimes revision videos are perceived by students as, say for example, a 2-hour video of ENT. It's not like that. In DocTutorials, the QRP is not too long and not too short. I think it is optimum. Many a times when students rely on random revision videos, they are either too short. Too short means that it will give you only a pseudo confidence. But did you feel that whatever is covered in the QRP in DocTutorials at the optimum, the description of the content?
Yes, sir. Every useful information was there in QRP. So if we are short of time or like that, we can use QRP itself for the source of preparation. I feel every important aspects are covered in that. It's extremely useful for everyone. Yeah.
And from the lectures, coming back to the question practice, obviously for any aspirant, practicing more and more MCQs is important. And DocTutorials has an elaborate QBank. So I just want to know, like many students tell me, sir, is it possible to do entire QBank? I tell the students, try to do as much as possible, because everybody has their own method of learning. But from your side, I just want to know, how did you find the DocTutorials QBank in your MCQ practice?
So that QBank is actually well concise and it is to the point, and the questions are actually well selected, I feel. Actually, in some of the apps, the questions are not very relevant actually, but in DocTutorials app, the QBank is actually extremely relevant to the point. Actually, what we want, that is the thing. It's not too easy also, it's not too tough. Actually, we should not go out of syllabus actually if it is too tough. Actually, it is a moderate level, similar to NEET exam actually. It's not too easy, not too tough like that. So actually it will simulate the real exam.
And what about, the importance of giving grant test? It is something that I always stress whenever I take a lecture or maybe an orientation session, that students should give grant test. So how did you find the grant test in DocTutorials? Especially, we had multiple grant tests which had video explanations as well. So what is your take on the GTs of DocTutorials app?
The GPs of DocTutorials are actually very, I already told you, to simulate the real exam itself. And the video explanations are really good, because once we review the GT, actually we take somewhat 4 hours actually, if you are reviewing it alone. But if we get the video explanations, we can do it within 2 hours or 1 hour maybe. So it is extremely useful when a teacher is actually explaining your mistakes. Actually, there is no substitute for that actually. You cannot self-review the GT like when a teacher explains, it is always very good, and it's actually very good feature of DocTutorials app. The video explanations are extremely good.
And in this current era of multiple apps, sometimes what happens is when you prepare for a long duration, especially this NEET PG exam got postponed, always a faculty mentorship is very important. And when it comes to DocTutorials, we had a visits group, which you were also a part of. So how did all the faculties of DocTutorials app being in the visits group, replying to queries, did that actually be a support system for you?
Yes, sir, of course. All the faculties are very interactive and we are like a family itself. We used to ask all our doubts in that. We clear it that time itself so that we don't want to go for any other sources or any chat GPT, nothing to find the solutions for our answers. We can clear it then and there itself. So that's a very good boost to our preparation, I feel. That WhatsApp group is extremely useful. And even for our mental health also, when the note of postponements, all those happen, they will always support us, I feel.
Right.
Yeah.
So I'm extremely happy for you, Athira, because I've seen you for the last few years, right from the time you were a final year MBBS student, the day you passed the exam, and then from there, I remember giving a call to you on how you're planning the entrance preparation. I asked you, like, are you disciplined enough to prepare with the recorded lectures, or you want, the face to face? You said, "Sir, I am disciplined." If you remember that call, and I think you went
Sir, I
forward.
remember.
I'm extremely happy that you got this amazing rank of 114, and I'm sure the entire team of DocTutorials is also extremely proud of you. Once again,
Sir,
hearty congratulations.
yes, sir, I am thanking you as well as the entire team for your efforts. Actually, your efforts are very good, actually, sir. I'm extremely happy with your teaching and all.
Thank you so much. Thank you so much. And Athira, all the best for the
Thank you,
future.
sir. Thank you, sir. Thank you.
Thank you.